morning, Doctor. My name is EshikaParuchuri, and I'm a junior at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate and empower adolescents around the world to help them construct a healthier lifestyle by working with experienced doctors across various specializations around the world. In addition to promoting health education, I hope to inspire interested teens to pursue careers in the field of medicine and healthcare, not just as future leaders, but as individuals who are prepared to respond to urgent public health challenges from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Jeffrey Fried, who specializes in general surgery. He has vast experience in this field, working as a surgeon and clinical professor at the Icahn School of Medicine at Mount Sinai in New York. He also holds a master's degree in the field of public health. And for this episode, we'll be focusing on general surgery facts, public health issues that concern teenagers, as well as the steps that can be taken to have a healthy lifestyle. And now, Dr. Fried, can you give us a little background regarding your experience in this field?
I've been practicing medicine for 5 decades as a general surgeon. I am a product of public education. I graduated from Brooklyn College and Downstate Medical School. I was very fortunate in a time where my education was available at reasonable cost, unlike today where education has become a real onerous undertaking. But I've been lucky and I've been in Mount Sinai since the beginning of my internship, which, as I said, was almost 5 decades, and have enjoyed every moment of it.
Wonderful. Okay, let's dive right in. So, firstly, how do you believe surgery connects to public health overall?
Surgery is very often an unaddressed problem that people have, either because they're unaware that they have a surgical problem or that the access is lacking for them to actually get treatment. As far as their knowledge is concerned, patients are often what we call medically illiterate. They have not had any background education in basic healthcare. Unfortunately, a lot of the inner city schools and public schools in general have done away with their what we used to call hygiene or health programs at the high school level, where young people learn about basic medical knowledge, which I think is essential for people to actually be able to go into their adulthood and be able to care for themselves, essentially. And there are a myriad of problems out there that young people face. And when I say young people, anybody under 30 is a young person. The biggest problem of which is obesity, which is epidemic in our country today. And the other problem, of course, is drugs.
Yeah.
Those are 2 problems which, unfortunately, I think the school system has failed to address and has really done a disservice to the students who have come through the system.
What are some public health issues that you often see that are reflected in surgical patients?
Well, as I said, the number one thing is obesity, which increases the risk of any operation. An obese patient is more likely to get an infection. They're more likely to get blood clots in their blood vessels, which can be very harmful. Their ambulation is less. They can't get around as well. And all these things lead to increased risk of any surgical operation. So problems like this really reflect on results. They reflect on life expectancy. How long the average person lives is really very often determined by the fact that they're obese when they're young, which leads to things like high blood pressure, like diabetes and heart disease, which are not reflected when you're 20, but they're reflected when you're 50. And if you have major disease by the time you're 50, that really started when you were 11, your life expectancy is going to be significantly short.
Mhm. And what role does prevention play in reducing the need for surgery?
But one of the areas that we know is that obesity surgery has become very common today. And this is a matter of one, genetics. There are people who have the tendency to be overweight, and we don't address that in an early phase. Unfortunately, we don't identify it. Unfortunately, sometimes we even shame it, which is even worse than not identifying it. And that's a cultural problem. You make people withdraw, and they don't get the appropriate medical care. They don't get the appropriate social interaction to let them develop into really capable, interactive people. And this is a big negative to society. You can lose a segment of the population who doesn't want to be out there. And I don't think the drugs that we have now, we have drugs, GLP-1s, that help people lose weight. And I don't think that the surgery is really the answer. The answer is that we have to educate people about eating. We have to educate people about exercise. We've taken the physical education programs out of the schools to save money. We've done everything we can to undo 100 years of trying to make our children healthier, and we've been able to undo it in 20 or 30 years. And I think that's a great disservice to the young people in our community.
I agree. And I see that you've mentioned factors like diet and exercise. How important are they for preventing any health issue in general?
We know that appropriate dieting, we're talking about growing children, so they need a certain number of calories, is where you obtain those calories that really determine how healthy you're going to be. If you get your calories from chocolate bars and potato chips, it's going to be very different than getting those calories from chicken and fish and steak. You want to build muscle, not fat. And some of this is educational, some of it's cultural, but all of it's related to education. We have to make people understand that when they give their children a bag of potato chips, that 30 and 40 years later, it's going to cost them. The kidneys are not going to work. They're going to have heart attacks. They're going to have strokes. They're going to have to be on long-term medication for their multiple medical problems. We determine what's going to happen 30 and 40 years later by what happens to children. And I don't think people really understand the relationship between what you do at 10 and 15 and what happens at 50 and 55. And I think it's really going to take a major effort to really obtain that. I think we have to put the exercise programs back in school. I think we have to value exercise. We have to value a good diet. It's putting the benefit, telling people that they're getting something out of it that really will make people's behavior change. Changing people's behavior is not easy, but to certainly never accomplish it without making them understand the value of that change.
And I just wanted to follow up, but do you think social media has had a more positive or negative influence on sort of the habits that adolescents now are forming?
In my lifetime, and perhaps it's my prejudice, but I will add that caveat. I think social media has done more to harm young people's health than any other thing that's come along. I think for two reasons. One of which is very often you've lost the person to person in face to face interaction, which teaches people how to get along. And two people together, 10 people together, working in a group, working in a team. These things have had value in societies for 300,000 years. That we worked together and we saw each other every day, and we knew what people were doing and how they were feeling and whether they hurt themselves, whether they were depressed, whatever. I mean, that had value in a community. We're tribal people. And to take that out of society and put it in a little box in your hand, I think has done a disservice. The other thing is, I think that it is at least partially responsible for the increase in psychiatric problems in young people, which has definitely increased in the last 20 years since social media became so popular.
Yeah.
I think people watching pretty smart people online who may not be so smart and may not be really so pretty and may be very depressed, but hearing that their lives are perfect and your life isn't, I think creates an environment which you feel perhaps not as good as you might. And that's why people have to interact. They really have to find out about each other. And if all you're looking at is pretty pictures and people having a good time and what they had for dinner, it creates a problem. And it has created a problem. It doesn't, it not will, it does create a problem for people. And there's no question that it may not be cause and effect, but it certainly correlates to the increase in mental problems and social media.
Mm-hmm. In addition to social media, how do you think the COVID-19 pandemic has impacted the health of many people?
I've written about this actually. I think that the pandemic itself, obviously, which took 1 million lives in the United States and locked us up for 3 years, caused a major, not only physical deficiency in our healthcare system, but also a psychiatric problem of literally locking people up for almost 3 years. I think we handled the pandemic very poorly. I think there's evidence of that now. We locked up 5-year-olds for at least a year too long. We should have opened the schools at least a year earlier, if not more. But and everybody agrees now that at least a year we wasted. I think that it will take anywhere from 10 to 20 years to catch up with what has been lost intellectually. The best will always do well. But the people that aren't the best, that struggle, that loss of education time, that loss of social interaction, that loss of receiving extra help will cost us for a long time to come. We have to really rethink how we deal with these things, and who should be making the decisions. This is not a political statement. This is a purely medical statement that doctors, epidemiologists, infectious disease people should be running the show, who have knowledge and experience to understand not only the illness part of it, but the implications of the actions you take to deal with it. In spite of everything we did, we still had the highest mortality rate in the world. So we didn't do so well. And we have to look back and say, one, what did we do? And two, let's not do it again next time. And there will be a next time. I mean, it may not be in our lifetimes, but there will be a next time. I promise you, because that's the way it works.
And do you think that the reason our country has such a high mortality rate could be due to the lack of health education and addressing general public health issues?
We, we don't have a unified system
Yeah.
that takes charge. This isn't a state issue. It's not a city issue. It's not a national. It's a disease issue. And that disease issue has to be handled by people who know how to handle an epidemic. And until we recognize that we need organized systems, and it's about a system that can deal with these kind of problems, we will continue to make mistakes because everybody will be making their own decisions. And that's not how to take care of an epidemic. It's just not. When we had the flu epidemic in 1918 and 1919, we had a lot of people die because of political issues. We were entering war, and nobody wanted us, to know that we have a flu epidemic in the country because we were sending all these soldiers off to Europe. We were the cause of flu in Europe. They weren't the cause of flu in the United States. We sent flu to Europe. I mean, you have to have a system that prevents this from happening. And until we recognize this and put it in place and make it ironclad, so no administration, no person, nobody can change that. That's the way you deal with this. Then we will continue to fail in these situations, which we did.
That's a lot of insight. And now, to shift the topic a bit, how do you think, or how do you help teens who feel, or not just teens, but young adults in general, feel less anxious when approaching surgery?
I don't take care of a lot of teenagers in what I do. I do a lot of colon and rectal surgery, so this is unusual for me to see teens, but we see some. I think the most important thing with teens is to treat them like people. I mean, that's the simple thing. Sometimes doctors tend to talk to parents and not to the teen who is actually the patient. Excuse me. It's a terrible mistake. The patient's always first. And if you treat them like a human being, like you think that they have a brain and are participating in the decision, and you ask them if they want the surgery, do they understand the surgery, right? What are their expectations from having this operation? If you actually treat them like you would treat any adult, I think they really respond to that. I think they tend to trust you if you treat them like people, and they know they can approach you if they have a problem or a question. I think it's very important. People tend to treat younger people as if they didn't have a brain and they were incapable of making a decision, which we know is not true.
I think that raises a very important point. I also wanted to talk a little bit more about mental health. How or what role do you think mental health plays in preparing for and recovering from surgery?
Attitude is very important, clearly. We know that people who go into surgery with a positive attitude and who are instructed, who are told what the surgery is going to be like, what it's going to be like in the operating room, what it's going to be like in the recovery room, and what their postoperative course is going to look like, right? They're going to have pain for the first 5 to 7 days. Then it's going to start to get better. The more they walk, the less pain they're going to have. I mean, if you explain things very carefully and create reasonable expectations, all right, young people do great because physically they're much more capable of tolerating the trauma of any operation. But as you said, the attitude, the mental state that they go into the surgery with has to be positive.
And do you think that this can be achieved through the proper communication between the patient and the physician?
If the physician is willing to listen to the young person's words, if a teen tells you they don't want the surgery, that doesn't mean they don't want the surgery. That means there's something going on that is standing in the way. So you have to take that extra 5, 10, 15 minutes to actually talk to them about why they feel that way. And why, they had a friend who had the same operation who wound up in the hospital for 3 months. Something happened along the way that caused them to feel that way. I have no expectation that a 15-year-old is going to understand, why their hernia is being fixed.
Yeah.
But, they had a friend who limped around for 3 weeks and they didn't want to do that. I would understand that. It's frightening. But if you can tell them that that's the unusual, and if they want to push through, they can really be back on their feet. In 3 weeks, they can be back to normal activity. And answer the questions they have, and say why that's an unusual situation, not the usual. Right? Most teenagers will understand if you take the time to talk to them. It's all about trust. It really is all about trust. No matter who, whether the patient's 92 years old or 12, it's all about trust. It's about letting the patient know that you care, that you're willing to spend the extra time.
If you could share one key message directly with all young adults listening right now, what would it be?
I think what young adults forever, not today, but forever, have believed is, including myself, I don't leave myself out of it, is that they're indestructible. This is a very common theme that runs through young people, that they're indestructible. And in fact, they're pretty tough. I mean, they fall, they jump, they bang themselves up, they break bones, the bones heal. All these things are true. What they don't understand is what happens today will be reflected down the road someplace. All right? And it's very hard to think about 30 and 40 years from now. I know.
Yeah.
But minimum things, a little exercise, a little watch your diet. Don't be 30 pounds overweight, be 10 pounds overweight. Make an effort that will be reflected in a better life. I mean, the morbidly obese not only have surgery for their obesity, but they have back problems. They have their hips replaced because of all the pressure on the hips. They have their knees replaced. They develop diabetes. They wind up on dialysis because their kidneys fail. It's a high price to pay for a bag of potato chips. You have to understand that this is all going to be reflected down the road. And I wouldn't bang them on the head with a hammer, but I would try to teach this and let them ask questions and show some pictures and let them understand what happens. A little bit is better than nothing. If you get a little response, it's better than no response at all. The other issue is drugs, which it so saddens me that 100,000 people die a year from opioids. It's very sad. And clearly, society has participated in those deaths. We gave people drugs that we knew that were going to hurt them. And shame on everybody involved. And all those people should be in prison. They're not, but they should be. And money doesn't make up for that if you lose a loved one. But again, there's a price to pay. There is a price to pay. And then think carefully about whether you're willing to pay the price on day one. Right? Before you start, think about down the road, if you're one of the people that's not okay. Right? Was it worth it? I would make it as simple as that. And see, it's a difficult problem that we've never solved. Yeah. But hopefully, we need a little bit of education.
Okay. And now let's dive into what a career in surgery actually looks like. What inspired you to become a surgeon?
I wasn't good at anything else. I knew I was going to be a surgeon very early on. It was something that really appealed to me. The whole idea of having a problem, right? Creating a plan, executing the plan, and watch the patient get better in a finite space of time was so appealing to me. And I couldn't imagine doing anything else. But accepting that this is a difficult life you choose. This is not a simple life. In fact, becoming a doctor is not a simple life. And you have to be, what the advice I give people is become a doctor if you love it. If you don't love it, don't do it. Don't do it. Don't do it for other reasons. You have to do it because of love. It has to be what you really want to be. And it's more than a job. It's a life. It's a lifestyle. Different than everybody else's lifestyle. Okay? You're never off. You're always a doctor. I mean, you're returning, you lie on the beach in St. Bart's and nobody's phone rings. If you're a doctor, your phone rings. It's a different life. The expectations are different. People have different expectations of doctors than anybody else. Right? That this is it. I don't know what to tell you. Again, if you don't love it, don't do it. It's too hard, too tedious, too many years, right? Most people wind up with significant debt, which is difficult to pay off, changes your whole life. And too many people are unhappy because they didn't go into it because they loved it. They thought it was a good idea. It has to be more than just a good idea. It has to be something that you want to dedicate yourself to for the next 50 years. It's a long time.
Yeah.
most doctors retire in their late 60s, and you make your decision when you're 21. So it's almost 50 years between the time you make a decision and the time you're going to hang up your spurs. And you better love it. Or it's going to be a tough 50 years.
Okay. And what are your thoughts on how the field of surgery has evolved within the past few decades? What do you think has changed most from when you first started working in this field to now?
I mean, clearly the technology has taken over surgery. Not a little bit, a lot. I mean, it really is a different world. It's the world where the person who played video games the best is the best surgeon. Everything is technology now, from robots to laparoscopes to diagnostic tools to AI. We now have programs that walk physicians through difficult operations, and AI says, stop. It's time to stop now and look. So we have an outside force that knows all the potential problems and says, these are the times you really should stop and look. Right? Which is remarkable to me, because when I started surgery, we were literally on our own. Every time we went into the operating room, it was you and the patient, and that was that. But now it's a whole different world. And this is only the beginning. It will evolve further. It will evolve further. You'll always need surgeons, because there'll always have to be somebody there when it doesn't go the way it's supposed to. And there are times it doesn't go the way it's supposed to. I mean, AI can be as smart as it wants to be, but there are going to be days that it just doesn't work, because that's what happens in surgery. So there will always be surgeons. Our roles are going to change, though.
Mm-hmm. And if you don't mind sharing, what is one of the most memorable cases that you've worked on?
That's interesting.
Many options.
I mean, there have been a whole bunch, obviously, through the years. Most gratifying was an 11-year-old boy hit by a car when I was a resident. He was essentially dead in the emergency room. Couldn't breathe. He had collapsed both lungs, multiple fractures, and I mean, really was a mess. Unfortunately, the person driving the car was a priest. I remember that vividly. Who cried for days. He came every day and sat there. Maybe that's why it's so memorable, that somebody cared so much and prayed for this kid so much that he would survive. And we did everything we could. We put tubes in both chests and did a tracheostomy and did all kinds of things. And we took him to the OR and fixed what was broken. And he was in coma for 11 days. And he woke up. He woke up. He wasn't dead. And he woke up intact, which was remarkable to me. And it made me think that perhaps there's more to this than meets the eye.
Yeah.
More to this than just the scalpel and the tube, and maybe there's something else. And I never forgot that case. That case is a long time ago, but I even remember his name, which I won't say, obviously. Yeah. That left an impression on me for a long time. And I was delighted that it survived. Absolutely delighted.
That's very nice to hear. That was very nice to hear.
Yes.
And do you think that moments like those have helped you keep pushing through as you progress through your career?
So I'll be the first to admit they all don't all wind up like that. They really don't, no matter what you do. They don't all wind up like that. Some of them wind up very badly. There are things we cannot fix. And you remember the good times. You also remember the bad times. But you keep plugging and hopefully wait for the next good time. I mean, most things that most people see, unless you're a trauma surgeon, that you do this every day, right? Most things that we see are relatively routine. We've done them multiple, hundreds of times before. Every once in a while, a case comes along that really you think you made a difference. And those are the things which keep pushing on. I've made friends. I've been adopted by families. I've been traveled internationally from people who were grateful. I mean, there's real rewards from this. Beyond, we're not talking about money. We're talking about if you can take that gratitude in and it keeps you going. Keeps you going. It makes you think that you actually made a difference. And that's a nice feeling. And if you can't have that, you shouldn't be a doctor. If you can't take it in, and you're making a difference in people's lives, you should do something else. You should be whatever. But you have to be able to take the wins in. When you win, you better take that in. Otherwise, it's going to be hard to go on. You're going to get frustrated. You're going to get burned out. You're not going to understand why you were there.
Yeah. Okay. Let's progress into our next segment of our interview, which will consist of some Mythbusters. So I'll be reading out some common myths related to surgery, and let's find out if they're true or not. First, surgery is always the last resort.
False. And the things that if you have a hole in the intestine, it's the first resort. You don't close the hole, the patient dies. There's no other treatment that will save the patient except closing the hole. So very often it is the only way to go. Mm-hmm. Also, at the other end of the spectrum is a quality of life issue. If I am a stonemason and I have a hernia and I can't work because every time I wield that hammer I get pain in my groin, then the best thing to do is fix the hernia. And he goes back to work in 6 weeks and he's fine.
Yeah. Oh, okay. Recovery takes months.
Recovery has two aspects. One, what physical condition you were in before the surgery. If you were in great shape before the surgery, recovery can be very quick. If you were in terrible shape before the surgery, it can take a long time. That's one part of it. And the other part is your attitude. If you want to push through the pain and walk around and really mobilize yourself, you get better faster. I mean, it's been shown forever. So we know that. Some people takes months and months and months, and some people will get better in no time.
Surgery leaves big scars.
Not anymore. You can't see the scars anymore. They're tiny. The instruments we use today are a centimeter, a little bigger than the tip of a pencil. So scars it's very rare that we have to make a big incision.
You can't have surgery if you're old or sick.
Okay, so there's what's called a frailty index.
Mhm.
And the frailty index tells us if you give points to each of the factors, your ability to walk, are you living independently, have you lost weight? I mean, there's a whole group of things that we measure that will tell you the risk of surgery. But then that's on one side. That surgery is definitely riskier in this setting, no question about it. On the other side is surgery the only answer to the problem? Do they have a problem that can only be fixed with surgery? Otherwise, they're going to die. And then you take those two things and you go to the patient and you say, your risk is this, but if you don't have the surgery, you're going to die. There are 98-year-old people who say, make me comfortable and I'm okay. It's time to go. And there are other people who say, I'm willing to take the risks, and then what we do is try to optimize the patient, try to fix as much as we can before the surgery. Whatever it is, the blood pressure, the diabetes, whatever it is, we try to make it as normalized as possible. All right. And that increases the survival. So old and sick is not by itself a contraindication to surgery. There are a lot of factors that play in.
Okay. And lastly, surgery is very risky.
Surgery is risky. That's an interesting statement. We do millions of operations in this country every year. It depends on what you're operating on. It depends on the medical status of the person you're operating on. It depends often on the skill of the surgeon for the particular problem that he's operating on. Certainly, if you're having open heart surgery, you want the best heart surgeon you can find. You don't want to do it in a little country hospital with one fellow who does this every 3 months. I mean, so there are a lot of factors that play into it. We have most things down to protocol at this point, that we have algorithms for all these things now. Surgery is only risky if the disease is risky itself, all right? You're in terrible shape, or the operator, the surgeon, really doesn't have enough experience to do the operation. So that speaks to the education of the public, medical literacy. You have good health care is a participatory sport. You have to participate in your health care. This isn't a gimme. You have to do a little research. You have to meet the surgeon. You have to be comfortable with the surgeon. You don't have to go to the first person you were referred to. You can look for somebody who has more experience, who's more well-known, who's done more of these procedures. That's right, but that's medical literacy. And that's part of the patient's responsibility, not the doctor's responsibility.
So a lot of this really ties back into medical literacy and health education, so just proper communication.
As we said, you're absolutely correct.
Wow. Okay, and with that, our podcast session has now come to a conclusion. Thank you once again for your time, input, and contribution. I think this was a very fun and engaging podcast. So thank you so much. And for our listeners, don't forget to
nourish your lifestyle.
nourish your habits.
Nourish your habits, flourish your lifestyle.
Thank you.
Thank you, dear. Have a great day.
You too.